Good evening. Now, my style is different. I'm a little loud, a little brash, but never boring. So, let's start. Thank you very much. Really, thank you. I appreciate this. Gloria and I were just talking a little bit. I think we've been to more churches than we've ever been in the past few years of our lives. But let me backtrack a little bit. You need to know a little bit of information about me. My full name is Jennifer Mijares Zimmerman. I always say my middle name because it gives you an understanding or an insight as to the origin of my story. Yes, I wasn't born in America. I was born as the eldest of 6 children in the Philippines. My parents were born in fishing villages. They didn't have much. But through sheer determination, a strong faith, and hard work, they rose out of poverty. Not to mention good education, and my goodness, the never say die attitude. My father did not get married until he was 50. Let's just say he had a little bit more fun before he got married. But his early life, though, was a little tragic. He was orphaned at 6 years of age. He had to fend for himself. 6 years old. Just like some of those kids at the border. No mama, no papi, nobody. 6 years old. Imagine that. A country mouse who went to the city when he was a little bit older, perhaps 12, 13, trying to just make a life for himself. And he was called an animal because he was browner, 50 shades darker than some of the city folks. Yes, he was called an animal. But that animal was persistent. He refused to give in to his baser instincts. He wanted to prove them wrong. They didn't want to give him a chance, but you know what? Despite some of the evil and the cruelty around him, there were always some helping hands. He became a prisoner of war and a World War II veteran during the Pacific. He could have easily surrendered, but he told us there was no way the Japanese were going to take over his country without him fighting back. They were going to have to catch him dead before he would do anything that they told him to do. He survived, and he became a merchant marine, United States merchant marine. So that little brown boy came to the U.S., became a citizen, and died an American. Throughout my growing up years, I was told that America was the savior that gave him a second chance at life. Whereas some people already said, you're just better off, you're probably going to be a juvenile delinquent anyway, you're going to end up in jail. He refused to give in to that. My mother was not allowed to go to school in the fishing village because they didn't have enough resources, and whatever little they had, it was meant for the boys to go to school because women were just supposed to stay at home, have babies, clean the house, wash the clothes. That's where I get my rebel spirit. My mother escaped a few times, went to the school and peeked in the window to see what the boys were studying about. And she said, "Oh, I can do that. That's easy." They'd pull her hair and say, "Go home. Women don't go to school." Nevertheless, my mother persisted until she met my father. They were 25 years apart. And he promised that if we had a little bit more extra money, you will go back to school. So, when I was 7 years old, first grade, she did go back to school. Probably the equivalent of an adult school over here. She went at nighttime, while raising 5 children and an extra one later on. But since she came also from the boonies, she didn't know how to speak a lot of English, so guess who had to translate a lot of the paperwork? 7-year-old Jennifer Zimmerman, or at that point it was Jennifer Miharis. I had to grow up quick. Webster's dictionary was my best friend for a long, long time. National Geographic too. I memorized all the tribes. Because I thought one day I'd be somebody. I'd travel, and I'll prove to them that the color of your skin or the origin of your country does not determine where you will end up in life and how far you will go. I have to thank my mom and dad for that. They never let the lack of money or resources stop us from pursuing our dreams. So a lot of people questioned me when I wanted to sort of challenge the incumbent and said, yeah, you're good, you're educated, you're this, you're that, and they went through that, went down the long list of my accomplishments, but it still wasn't enough. You know, you're a woman, you'll never win. Well, ladies and gentlemen, I think we need to prove them wrong, don't we?
Yes.
Absolutely. Because this woman can. This woman fights. I've been a pediatrician in the district, the entire district, for over 20 years, or almost 20 years. I was trained in New York at Long Island Jewish Medical Center in general pediatrics. That too has a story, but I'll reserve that for a later day. We do have to go home sometime. I went to Central Florida as part of my immigration payback. I came in here on a different visa. And despite marrying my husband, who is Jewish, and that matters because in our family, we are what you would call the cashews, Catholic Jews. My kids are happy because they can celebrate both Hanukkah, and they get a gift every day for 7 days or 8 days. And then it segues into Christmas. My goodness, my kids always have a gift. But that's important because in our family, we do not discriminate based on religion. And because of my immigration story, we do not discriminate also based on your country of origin or whatever food you eat. The more food, the merrier. And if you know any Filipino, you know. We don't greet you by, hey y'all, how you doing? It's always, hey, have you eaten? If they don't say that, they're not true Filipinos. So, as a pediatrician, as I said, I started in Central Florida and moved over to Crestview, which is Okaloosa County. That was 20 years ago. In fact, my second son who's here today was born at Fort Walton Beach Medical Center. My first son was born in New York, and my daughter, who was my little medical crisis, was born at Sacred Heart Children's Hospital. I'm fighting because as a doctor, I'm concerned about the state of our healthcare. Florida ranks in the bottom, number 47 out of 50 states. 47 in healthcare access. And if you're not aware right now, there are pending lawsuits all over the country to undermine the protections though, that if you have a pre-existing condition, you're not supposed to be discriminated upon by any health insurance company. They're about to undo that. Since they could not repeal the Affordable Care Act in the front, they're going to go behind it, underneath it, beside it. It doesn't matter. They're going to rip it apart anyway. So if you think this election is just a midterm, if you think this election is just about sitting down because I don't really care, there's only 3 Democrats in my society, there's only 2 Democrats in my community, there's only so many excuses I can give. If you think that this does not affect you, you are just one health crisis away from a bankruptcy. If you think that it doesn't affect you because you have good health insurance at this point, wait till they start dismantling every protection you have out there. We will no longer have the protections even for those who have the least They are dipping into Medicaid as we speak. They're cutting back. I have patients. My patients, by the way, are mostly the underserved. So for 20 years, I have languished in that single-payer system that they so criticize. I'm living proof you can live. You can live if there's equal access for everybody. But you see, if they go to the emergency room because they have a medical crisis, you think it doesn't affect you? Think again. It's called uncompensated care. And if those hospitals cannot make up for that uncompensated care, they will close down. So guess what? That gauze pad now costs you, who has United Healthcare, it will now cost you $20. That Tylenol that you can buy for 10 cents will now cost you $50. And the list goes on. You still think the midterms is just the midterms? Remember, we have babies. We have babies at the border, and God knows which state they end up with. We have babies crying out for our help. If we don't send the right people who can make legislation that is fair and decent and humane, it will get worse. If you haven't read the newspaper, they have done away with the protections of the immigration court. So my son here, who is 50 shades darker than probably a lot of the kids in your community, if he walks down there, he looks Latino, and the police stop him, they can send him out of this country because he does not have the protection of an immigration court. Apparently, the only immigration allowed in this country is if you are of a certain color, or if you're from Eastern Europe, or if you model and you have exceptional abilities. We're not going to delve into that. So please, I ask of you, there may be few of us, and there's more of them. But change always starts from a few. A single pebble thrown into the lake can have a ripple effect farther than what you would imagine. They say that there should be a blue wave. No, there should be a blue tsunami. Amen. Because if we don't change the people who are making our laws, they will be filibustered, they will be silenced, they will be told to zip. But this woman has been told that all her life. My mother was told that all her life, and guess what? I know how to persist. I will not be silenced. And I intend to bring this loud voice over to Washington, D.C., a voice that we have not heard from this district. We've always sent the same frat boys over there, and what has it done for us and the rest of the country? We will no longer have rights before you blink your eyes. And why did I say my husband was Jewish initially? If you do not know your history, think again. The gas chambers were not their first act. It was to divide them and us. Divide so much that you didn't care after a while. You were so tired from resisting. You got tired and it became the normal. The Jews became the vermin. The gypsies were killed. They rounded up the children. And the next thing you know, there was smoke from the chimneys. We don't want to be the next Auschwitz or Dachau. You don't want to know El Paso as the next burning ground for these babies, or Tornillo, Texas. Please, I beg of you. God is watching. He knows what's in my heart. He knows what's in all of our hearts. We need change. Not just because I'm a woman, but because I am a real smart woman with a heart. And if you don't believe that, look at my 20 years of service to this district. I could have chosen a different job. I could have gone back to New York. I chose to stay because the children needed me. And while campaigning, I am exhausted because I am still serving the children of our district. I cannot abandon the children. Unless I get that nomination and win, the children will still be taken care of. And I aim to take care of all the children in this district, because this district needs a strong mother. Thank you very much. Well, as you know, healthcare is very close to my heart. So Dr. Zimmerman, President Obama made great strides with the Affordable Care Act, but still many are not covered. Do you believe in Medicare for all or expansion of Medicaid, and how will these be paid? First of all, if we can afford to grant a tax cut to those who need it the least, resulting in a $1.3 trillion deficit in our budget, we can find those resources for those who need health care. Let me explain what the Affordable Care Act is really all about. And it is the ACA. Don't let them fool you into calling it just Obamacare. Because Obamacare is what they use so that it has a negative connotation. Before the Affordable Care Act was enacted, a lot of us who have advanced in age and who may have had a few accidents actually were refused any kind of coverage because of pre-existing condition. Even pregnancy is a pre-existing condition. Acne could be also included. My daughter was also refused treatment for the fact that she had ear tubes when she was a year old. My husband was refused because he had a chronic illness. So the Affordable Care Act, its main goal was to cover as many people as possible, especially those who could not obtain any kind of health insurance due to these factors that I just said. It's very complicated the way it was done, but it was open to everyone. They consulted. Don't let them fool you either. There was a big amount of consultation that went on between the insurance companies, physicians. Everyone was represented. So let me tackle that. There was supposed to be an option where you can opt to the public option. But the Freedom Caucus or Heritage Foundation wanted to insert that personal responsibility that they so love. And so we ended up now with a portion of the Affordable Care Act where you would be penalized if you did not obtain your health insurance. That was in a way to stabilize the market, because as you very well know, if it's all sick people in it, then the insurance companies won't make money, and they will make sure that they will get back their money by raising the premium. So cut the long story short, yes, there was a certain segment of society or population that were able to finally obtain some coverage, despite the fact that they were denied previously. However, just like any other law that is first enacted, there are loopholes and there are people who might be excluded. Therefore, a complete repeal is inhumane and cruel, because when Medicaid or Medicare was first started, it wasn't perfect either, and it underwent multiple revisions. And that's what I offer. If we can sit down and actually see what had worked and not worked, and then we can sit down at the table, again with the input from all the industries concerned, and find out how we can best solve this problem of the rising premium because of all the stuff that they've done to undermine the stability of the market. Now, Medicaid expansion. Let me give you just a very concrete example so you will understand why this is very important, and this is what should have been done in Florida. By the way, that was in the law of the Affordable Care Act. So if they're talking about you must follow the law and we must be a law and order land, they deliberately opted out of the expansion here in the state of Florida. And therefore, we must elect the right governor. So here's the deal. Medicaid expansion covers those who are too rich to be covered, too poor to be able to afford the premiums for the Affordable Care Act, even with the subsidy. So for example, during the flu season, this is an example I give so you'll understand why this is important. If a child comes to me who is covered under Medicaid because they fulfill the requirements or they are covered under Medicaid, the child, I can test them if they have fever, if they have flu or not, and it's called a flu test, and if they're positive, I have to give them medication. Part of the protocol is to treat the whole family. Those who are negative for flu must be given a prophylactic treatment, preventive treatment, so that they don't reinfect each other and come back 20 times to the doctor. This is just a more economical way of cutting back on more medical expenditures, both for the family and for the state. Do you know how much it is to be treated for Tamiflu? A full 5-day course or 10-day course is preventive? $250. $250. For a family, for a husband and wife, that's $500. For grandma and grandpa, that's $1,000. And the list goes on and on. But they would have qualified for Medicaid expansion had Governor Scott allowed it. That's how important it is. So if we cannot, if in the interim, if we can get a governor who agrees to expand Medicaid, we will be insuring more than 1 million people in Florida. And to me, having access to health care is a lot more cheaper. Prevention is a lot more cheaper than trying to catch up and treat those who are already way beyond redemption or treatment. Medicare for all. I am open to the option of Medicare for all, because I believe that whatever option is available and will benefit the citizens of the United States of America, we must consider that and implement that. Yes, cost is an issue, but did you know that in our present system, the administrative fee for private health insurance is about 20% of whatever they collect? Medicare is only 3%. 3%. So to run the Medicare system would be a lot cheaper than to try and negotiate with these insurance companies. Those CEOs make a lot more money than they actually serve the people. We will have to find the revenue. We will find the revenue if we can undo the damage done by this unjust tax cost that we just did. There are many proposals out there, and I'll be here all night long trying to tell you all the proposals that have been done. Part of that will be the criminalization and possible legalization of marijuana. That has been done in other states. Colorado has been very successful. It is regulated, they pay taxes, and there has been an increase of income. I think it's time that we put it on the table and really have a serious study to see if this will work with Florida. As a pediatrician, I'm telling you, I am concerned about the ill effects of any kind of medication out there. But also as a doctor, I believe in science, that if we can do a task force or a public health policy or a study, we can always find out what works and doesn't work based on data. Not on conspiracy theories, not based on InfoWars, not based on what the president says or does. So I hope that answers your question. What's this?